Good afternoon, everyone. First of all, I would like to thank Mark and the FC3Rs for the invitation to provide you with this webinar. My name is Rita, and I'm going to walk you through the SmartHeart, our cardiac assay, and I will briefly mention the smart spheroplates, a technology that we have developed that can be also valuable to develop other human-relevant models. Let's start with the context, numbers that we all know very well, but we know that today there is a huge high clinical failure rate when developing new drug candidates, mostly because we are using models, either animal models or in vitro models that are not faithful to what the human body resembles. And because of this, we need to develop tools that help us to be more predictive and, of course, scalable. That's why we would like to introduce you to the SmartHeart and the SmartSphere platforms. And just to conclude this, we know that there is a lot of momentum from the regulatory part as well, from FDA, NIH, EMA, among others. So just to give you a bit of context on 4D-Cell. 4D-Cell is a biotech company. We are located in Paris. And primarily, we started to develop tools to control the cell microenvironment. And with time, we complexify a bit these tools, and we moved to what we call hydrogels. We started to engineer these substrates, and we developed the SmartSphere platform that allows to form, for example, liver models, pancreas, kidney, cancer, lung, adipose tissues, anything that somehow can be recapitulated with a spherical shape. But at the same time, we also developed what we call the SmartHeart, which is our cardiac assay. So it means that it's a platform that is used to seed cells that somehow can contract, and this contractility can be assessed here. It can also be used for other kinds of cells like skeletal muscle cells or smooth muscle cells. Just to briefly introduce you to the SmartSphere technology, and like any other technology that we develop at 4D-Cell, we try to disrupt the minimum, the workflows that academics and pharma already have in place. So we take plates that are already existing on the market, we add a layer of this hydrogel that we mold these cavities on it. When adding cells in the SmartSphere platform, what you see is that the cells go to these microcavities and they will self-assemble into this spheroid format. What is different here that doesn't exist on other technologies is that at the bottom of this microwell, there is what we call an anchoring point. And this anchoring point allows the spheroid to stay in place. And because they stay in place, they are all located in the same focal plane. And since we are using high resolution grade glass, let's say, imaging glass, we can use this for imaging purposes, and the spheroid is located very close to the objective in this case, because there is only the glass in between the spheroid and your objective. We can also do many spheroids simultaneously in the same plate, up to 5,000. Of course, there is a high statistical power linked to this. The reproducibility of the size and shape is quite high as well. And the most important thing is that it's a very easy to use platform, because you just need to seed your cells and they will self-assemble into these structures by themselves. Now we would like to go to the SmartHeart, the topic that we were invited to speak about today. So what you're seeing in this video is the same kind of technology, these hydrogels, but in this case, we mold a ring-shaped cavity. And when you add cells to this ring-shaped cavity, if these cells are contractile cells, they will self-assemble into this ring-shaped tissue that when it deforms and contracts, it deforms the central pillar. So let's go a bit deeper into this technology. We are using a hydrogel that is polyethylene glycol based. The shape of this cavity has been engineered in a way that the tissues stay in place for as long as possible. And for this, we have engineer this cavity so that the bottom is glass. It helps to anchor the tissue in place, and to maximize the number of cells that are used and not wasted, we have these conical shape walls that always guide the cells towards this area. The stiffness of the hydrogel can be tuned, so we can produce hydrogels that have a stiffness of 5 kilopascal, but we can also produce hydrogels with a stiffness higher, like 20 kilopascal. Typically, our products have a stiffness of 12 kilopascal, which is more physiologically relevant. The glass, again, of the bottom of these plates is number 1.5 glass. And this that allows you to have in situ recording of images and videos. And it's from these images and videos that we recover all the readouts that you will find after that we can measure. The tissues are composed by iPS cardiomyocytes and cardiac fibroblasts on a ratio of 3:1, and per well we typically use a total amount of cells of 65,000. There are 9 tissues, as you can see here, in each well. So this increases the statistical power of your data, but it also allows you to ensure that most likely there will be a tissue formed in a well. Even if the success rate is not very high, you should still have a few rings forming per well, which means that you will always have some data to collect. Because the platform is very flexible, let's say, we can also combine these with tools to paste the tissues. We are developing a tool to paste the tissues on a 96 well plate format. And the last feature we would like to highlight, feature or claim, is that, of course, that we choose this geometry not just by chance, but because we believe that this is more physiologically relevant and closer to the human morphology. In terms of workflow, it's very simple. What we provided for this cell are the plates. The plates have these hydrogels molded, and after you just need to seed your cells. The cells can be a mix of the cardiac fibroblasts and the cardiomyocytes. You seed the cells. After a few days, they will self-assemble into this ring-shaped tissue that will start to contract. And between week 2 and week 3 of cell culture, you can add your compounds and see how they affect the tissues, their contractility, for example. If you record videos at that time, after you can upload these videos in our SmartHeart 2.0 software and recover the contractility parameters like the stress, the strain, as you will see after. So, using this assay, all our readouts are image-based, and the first type of readouts that we can recover are contractility metrics, like the stress, the strain, the beating frequency, contraction and relaxation speeds. And this can be done just by analyzing a bright field or a phase contrast video of the contractile tissues. But we can also recover action potential metrics and calcium metrics. In this case, we will need fluorescent signals, as you are going to see afterwards. For the contractility assessment, it's very simple. What we do is that we analyze videos of the contractile tissues. It's what you see here in this video, and the software has an AI algorithm behind that detects and tracks the area of the central pillar, and after from this area over time we can calculate the contractility metrics that I just mentioned. In this second part of the slide, you see the effect of isoproterenol, and you see its effect quantified in terms of contractility metrics. And we all know, perhaps you know this much better than me, that isoproterenol doesn't have an effect in 2D that recapitulates what happens in the clinic. So we don't see a positive force frequency relation. But when using the SmartHeart to culture the cardiomyocytes and adding isoproterenol at day 14 or 21, we see both an increase in the beating frequency and an increase on the strain and the stress of the tissues. And this means that we have a positive force frequency relation. And this is a sign of maturation of the tissues. To assess electrophysiology, we use voltage-sensitive dyes like FluoVolt, and it's this that you are seeing here in this video. When the tissue contracts, there is an increase on the fluorescent signal, and what you see here in this graph below, it's when the contractility metrics are put together with the action potential metrics, and you can see both together. In this case here, you see an example of a drug that we tested at day 14. So ranolazine is overclassified as medium to high TDP risk and in 2D when using 2D as the model. But it's clinically proven to be a low TDP risk drug. And we can in fact see this when we use the SmartHeart as the assay to test this drug. The last metric we evaluate is the calcium. In this case here, you see similar image to what we were seeing with the FluoVolt, so for membrane action potential, but here to assess calcium, so we are using Cal 520. And for example, when we added a drug that is a calcium channel blocker, we see the effect of this drug on the calcium transient duration, on the amplitude, or for example, on the rise slope, as expected. For now, we have described all the metrics that we can assess with the SmartHeart. Right now, we would like to run you through the morphology of the tissues, because some of the drugs that you saw that were not well recapitulated when using 2D models are well recapitulated with the SmartHeart, and one of the reasons is because of the structural organization of the tissue. So first of all, we use a mix of cardiac fibroblasts with cardiac cells, so iPSC-derived cardiomyocytes. When we do scans of the tissues, we see that the fibroblasts tend to stay down and they serve as an anchor to the tissue, and as you scan the tissue up, you will see the organization of the cardiac cells. This becomes a bit more visible when we do this 3D reconstruction of the tissues, and it's much more interesting when we look into detail and we see the alignments of the cardiac fibers, of the sarcomeres. And when you compare this with a 2D cell culture, you see their disorganization of the cells. But when you see these tissues, you see that the cells are very well organized, much more resembling human cardiac tissue than a 2D model. To check how mature the tissues were, we did some preliminary tests. At 15 days of culture, we recovered the tissues for qPCR analysis, and we assessed the expression of different genes. We compared this with 2D culture, where we also did co-culture of cardiomyocytes and fibroblasts. And what we observed here is that for different mechanisms of the cardiac cells, we see that there is a higher expression of key genes, for example, for ion channels, calcium handling, the contractile apparatus, or the metabolism. We see that they are they are more expressed in the cardiac cells, in the SmartHeart than they were in 2D. So this is already a sign of maturation. To complete this, we are now running RNA sequencing of tissues recovered at 4 different time points: 7 days, 2 weeks, 3 weeks, and 4 weeks. And with this, we are going to study how the maturation of the tissue evolves over time. To conclude a bit the validation that we have been developing, we assess different drugs. These drugs, some are from the CIPA panel, which you know that it's very important in the cardiac field, and others are inotropic drugs that are not well recapitulated, like the isoproterenol. And as a summary, we have seen that all the drugs are well recapitulated in the SmartHeart, and most importantly, drugs that were not well recapitulated in 2D, here they are well recapitulated, which is already a sign of a higher level of maturation of the tissues. And with this, I would like to finish this presentation. and invite you to check our website, to send us an email, and to discover more about this assay in these platforms. Thank you all for your attention.